The first and most important tier of the new CDC guidelines is standard precautions. Since patient examination and medical history cannot reliably identify every patient with pathogens in their blood or other body substances, standard precautions apply to all patients. You must assume all patients are carrying pathogens such as HIV or hepatitis B or C. The first and most important tier of the new CDC guidelines is standard precautions. Transmission of these pathogens takes place by parenteral, mucous membrane, or non-intact skin exposure to blood and other body substances. You must take precautions whenever contact is likely with blood, mucous membranes, non-intact skin, or any other body substances, except sweat. The risk of infection can be minimized if all healthcare workers use the following standard precautions guidelines. Decontaminate hands before and after patient care, regardless of whether gloves are worn. If you are wearing gloves, decontaminate hands immediately after removing the gloves and between patient contacts. Wear gloves when touching blood or any other body substances, secretions, and excretions except sweat, or when touching contaminated items. Put on clean gloves just before touching mucous membranes and non-intact skin. Take care to prevent needle sticks and other injuries when using needles, scalpels, and other sharp instruments. Also be careful when handling sharps after procedures and when cleaning them. Dispose of used needles properly. Use a mouthpiece, resuscitation bag, or other ventilation device as an alternative to mouth-to-mouth resuscitation. These should be available for use in areas where the need for mouth-to-mouth resuscitation is predictable. Wear a gown to protect your skin and prevent soiling of your clothing during any procedures and patient care activities that are likely to generate splashes or sprays of blood and body fluids. Remove a soiled gown as promptly as possible and decontaminate your hands. Wear a mask and eye protection or a face shield to protect the mucous membranes of your eyes, nose, and mouth during any procedures and patient care activities that are likely to generate splashes or sprays of blood or other body fluids. You should immediately and thoroughly wash your hands or other skin surfaces after accidental exposures to blood or other body substances. Washing the potential contaminant from the skin may reduce the likelihood of transmission of any pathogen present. By following these standard precautions with all patients, you will be helping protect not only the patients, but yourself and other staff from the risks of infection with pathogens carried in the blood or other body substances.
It should be noted that the body substances covered by the standard precautions guidelines are more inclusive and cover more body substances than universal precautions.